start discussion.
Hi, please sit down.
Hi.
Right. Is that Sam Smith, is it?
That's correct, yeah.
Super, thanks Sam. Tell me, what do you understand by the term empathy?
Well, I understand it to be the ability of somebody to put themselves in another person's shoes, I suppose, is the typical definition. But that's understanding that person's or a person's feelings, their ideas, opinions, their experiences, compared to something like sympathy, where we might just have a feeling of maybe pity or commiseration. So I think it's more of a personal approach to somebody's feelings and experiences, and that would be what I understand.
Okay, fine, thank you. Can you give me an example of where you have seen an individual failing to show empathy? And this doesn't have to be in a healthcare setting, in any scenario that you may have witnessed.
Sure. So I was fortunate enough to spend a little bit of time in a healthcare centre in Tanzania. And there was a maternity ward there, and it was quite striking how the healthcare professionals had potentially become a little bit desensitised towards each individual patient's conditions, their suffering. This, going through labour obviously is a period of intense suffering for the mothers, and obviously a difficult situation for the whole family as well, particularly in some developing nations where healthcare might not be as easily accessible as it is in the UK, for example. And the attitudes of the healthcare staff, not just the doctors, but also nurses, midwives, healthcare sort of assistants as well, was just striking in the fact that they didn't necessarily treat patients as individuals. They were just sort of treated as jobs. And I think that was quite striking with how I might expect a mother to be treated in a similar kind of situation in this country. How we would expect, or I would certainly expect, a young mother, or any mother, to be treated with dignity and with respect, and I think compassion ultimately. I think empathy encompasses all of those different things as well. And so it was quite striking, the differences that I experienced there in that ward as opposed to what I might experience in this country.
Okay, anything else you want to add to that?
I mean, certainly in this, if it was me in that position as a healthcare professional, I would hope that I can make an effort to, formulate a relationship with a patient, no matter how long or short they're going to be in that situation, in that ward, and that I could at least hopefully do something to make them feel that they're comfortable there, treat them with obviously the dignity and compassion that we would expect certainly in this country. So I would use that experience of maybe professionals not showing that empathy to inform my own practice when I, if I'm fortunate enough to become a medical student and then a doctor.
Okay, thanks Sam. Now, is it possible to learn or develop empathy?
Absolutely. I certainly think it's not something that we're born with. So from a human development element, I think as babies, as children, we are taught to understand, if you've got young siblings or friends, understand and kind of empathise with people or at the same age of you in difficult situations. And so from a human development aspect, I think it's something that we are taught and learn through our experiences, through interactions with adults, interactions at school, etc. But also, I suppose from a medical student's perspective, as somebody or as one of us, a medical student, becomes more familiar with certain healthcare issues, certain healthcare conditions, whether that's symptoms, treatments, and the effects of those symptoms and treatments on the person, that we can develop our own understanding and therefore develop that kind of empathy of what that patient is actually going through, and not just the patient obviously, but their family as well. I certainly think it's something that we can learn, something that we can develop. Otherwise, we'd potentially all be sociopaths.
Okay, interesting, thank you. So I'd like you to think about any work experience or volunteering that you may have had, and if it's in a healthcare setting, I'd like you to try and describe a situation where you saw a doctor or a healthcare worker say or do one thing to improve a patient's stay in hospital or to improve their well-being.
Yeah, absolutely. So I was lucky enough to spend some time in a hospital in this country, on a ward, and it was quite striking actually how much of a concerted effort that the not just junior doctors but also medical students on on that ward, who were learning on that ward, spent the effort that they made to spend time with patients and to speak with patients on an individual level, and how that could, or they just spent some time getting to know them, speaking to them by their first name, that interaction of kind of friendliness, welcoming, making them feel comfortable, asking them if there was anything that they could do for them. And I just think those small things and the way in which healthcare professionals, certainly junior or learning, those people learning to be healthcare professionals, treated patients was really important in my understanding of a patient's stay in hospital. It wasn't necessarily one individual thing that they all did or that one of them did, but certainly as a whole, as a group, those professionals working for the patient and spending time with the patient was really beneficial, I think, for that patient's well-being.
Okay, thank you. So you may have heard of the NHS Constitution and its set of core values, and those core values are expressed as 6 C's, and one of those C's is compassion. And I just wonder if you could name, in the first instance, name any of the other C's. There's 5 more.
Certainly, yep. So there's care, which I think obviously underpins the whole of the NHS, and that's the reason why doctors, nurses, other healthcare professionals are in their industry, I suppose. It is an industry, it's a business, it's a vocation, why they're working in that vocation. So care, I think, is probably one of the key ones. And I think commitment as well is another. And I think that is a commitment to patients, to patient care, to doing the right thing for patients, and being committed in terms of their time and their work, and also for themselves, making sure that they're making a commitment to themselves as healthcare professionals. Courage, I think, is another. I think this is vital in terms of that idea of working for patients and doing the right thing for patients, having courage in terms of one's own abilities and own even limitations as a healthcare professional, and also potentially the courage to speak up for the patient when they think that something is perhaps being handled wrong or inappropriately, and having the courage to speak up, that whistleblowing element, I suppose. Communication, obviously, underpinning teamwork and working together for patients, which is one of the NHS values, and how the multi-professional team can work together and communicate together effectively, again with the patient at the centre of that team. And so we've got compassion, care, commitment, courage. Competence, I think, is another. I think that's the final one. Mm-hmm. So again, that's about healthcare professionals' abilities and their confidence in their abilities to ensure that they're carrying out their tasks and their work effectively, I think.
Okay, fine. So you've covered the list there. So I'd like you to think about those 6 C's that you mentioned, sure, and try and describe seeing one, or more than one, but at least one of them in action.
Absolutely. So in the same sort of ward scenario that I outlined a little bit earlier, when I was fortunate enough to spend time in a hospital, it was quite striking, the commitment element, but also the communication element of the multi-professional team, and particularly around those times where sort of shifts change. I think there was an absolute clear determination on the part of the junior doctors or the doctors on call or on shift at the moment to make sure that there was a comprehensive handover with the incoming team, and that they were up to scratch. The incoming team were up to scratch in terms of each individual patient's current condition, and what they were expecting. So there was an element of kind of clear communication there.
1 minute remaining.
And obviously a commitment that that team would stay until that handover was complete, and if that meant leaving at 6 o'clock instead of 5 o'clock, they were committed to doing so. So I think that really encompassed 2 of those C's quite clearly to me.
Okay, very quickly, because we've had the 1 minute buzzer, so we're
Sure.
going to be over very quickly, and we have to stop when we're told to. Do you have any idea of the catalyst for the NHS Constitution and the 6 C's? What happened and why they drew it up?
Sure. So I believe, obviously, the NHS values have been in place, I think, since the NHS Constitution was written back in the 40s. But I think out of the mid-staffs, with the report into care failings, I think it was 2008, 2009, obviously there was significant care issues, and the fact that a concerted effort was needed to be made to ensure that all healthcare workforce, so doctors, nurses, healthcare professionals, were working together for the NHS values and for patients. So that would be my understanding.
Okay, Sam, thank you very much. If you'd like to move to the next discussion.
Sure, thank you.
Thank you.